Good afternoon or evening, whenever you're viewing this lecture. I'm Dr. Chandra Story, and I'm providing some information to you for the module on interventions. Your PowerPoint is available in your D2L module for health promotion. You will need this information as you move forward in your project. As you're listening to the different intervention strategies that we'll discuss, you'll want to think about it in terms of college health and the different topics that are listed for your project. So whether you were in undergraduate programs very recently or long ago, you still want to consider which strategies might be appropriate for the topic that you've chosen for your final project for this course. You will be working with Ms. Lisa Schrader, who is the public health specialist on our campus for all things college health. We've provided resources for you within the module for this class and the project, but she's more than willing to assist if you need more information about those. And of course, Dr. Rye as well, your instructor, has a lot of resources that you need and experience as well to offer to you. Our agenda for today, as this will be a 30-minute lecture, 30 minutes or less, is to go through the PowerPoint that was provided to you within your module with some explanations and with some real-life examples. Hopefully this will help you as you begin working on your project and as you're reading through the PowerPoint, which is quite detailed for you. So let's begin. When I think about interventions, I get really excited. I'm really passionate because when we look at interventions, we're looking at actual programs or things that will invoke or create a behavior change in people. So it's not just about awareness, but it's about people actually being empowered to make a change in their own health. And as you know, when we look at the current COVID pandemic, that is so important, even as there's controversy around mask or how to wear a mask or different closings, we still realize how impactful interventions really are. And we'll get to that as a type of intervention shortly. I'm going to start here with slide number 1, designing appropriate interventions. As we look at this idea of interventions, it's important for you to understand key terms and key words around what interventions are. So when we create programs, we don't want to create programs just on a whim or what we think a good idea is for a population. Our Tennessee Department of Health and agencies nationwide use what we call best practices and best experiences to guide programs for our communities. Let's start with a few of those definitions and then go into some examples that you'll be able to grasp. Best practices are programs that have gone through rigorous, critical types of evaluation and research to determine that they actually work with populations. So, as you may have learned in some research courses or what you'll learn during your MPH, when we talk about a best practice, we're talking about something that has undergone some type of actual research study or even what you might consider a clinical trial. There's usually a comparison of one group to another one. And if not that, we definitely take our time and create surveys and evaluation tools that meet rigorous evaluation research standards so that we know and we can say, for the most part, that a program actually works. In other words, we know from evidence that our program actually helps people to lose weight or to wear their seatbelts or to take better care of their diabetes. Those are just examples that we would look at. Best experiences, another term that I want you to know for best experiences as we look at slide number 2, another term for best experiences is practice-based evidence. In other words, many of our communities have programs and practices that really work for them, but maybe they're not documented in a book, or maybe a researcher hasn't gone to research those things. As health promoters, we still want to look at those programs and communities at things that may really work. For example, we know in some American Indian communities, there are things called drumming circles where people will play the drums and they will discuss their culture, their heritage, and different things even around their health. When I worked in American Indian communities, we knew that was a best experience that worked for those communities when they talked about their mental health. So we include that when we consider making programs. So best experiences are important as well. Best processes, These are interventions that we've developed based on theory. When you take your theory course, also with Dr. Rai, you will learn even more about that. So we won't spend as much time on that today. But there are processes and practices that may work for a variety of communities, and we never want to discount what the community is telling us. One thing I neglected to share with you all is I've done community health education and health promotion in different ways across at least 3 different states with a wide variety of populations. And knowing these terms is so important, and knowing how to apply them and listening to communities. And I'll provide a few case studies during this lecture today to make things more applicable to what you may be considering. Other terms on here are segmenting and tailoring, and that simply means one size never fits all in health promotion. When we're developing interventions, as you're going to do for students here on campus for the project for Ms. Schrader, you always want to look at the different characteristics of your population, which means we know all college students aren't the same. MTSU is wonderful when it comes to diversity. We have returning college students. We have students who are parents. We have students who just came out of high school. We have veterans. We have people living with disabilities. We have people of different religions, racial, ethnic backgrounds. All of those things help us to segment or separate our populations, including culture, which means ways of life. That's not race. Culture, all of those things. We can separate that way and look at characteristics and then tailor our programs to be effective for our populations. The next slide, designing appropriate interventions. When you're designing an intervention, you want to look at what exactly are you trying to change. So identify the public health problem, and you all already have those. Some of your project titles include drug and alcohol use on campus, may include reproductive health, may include sexual health. All of those are the different specific topics that you have. Then the next thing that you would want to look at is what level of prevention are you considering? Those are things that Dr. Rai will discuss with you, but for your project, you'll be looking at primary prevention in a lot of ways. Some of it will be secondary, but most of it will be primary. The other thing that you want to really look at is what level of influence. Based on what Ms. Schrader has shared with me, you may be doing something for a virtual health fair. So that would be more of a group basis than a very individual counseling basis. So your level of intervention is probably going to be more group or more population based for your project. The next thing that you would want to do is consider what type of strategies is it appropriate for your population and what resources are available. All these things will be at your disposal. For example, for your project, Ms. Schrader has already provided resources for your needs assessment and also provided some locations for programs that are already working for college students, especially around drug and alcohol use. So, take home message here: we don't reinvent the wheel. We look at evidence-based practices, best practices we mentioned earlier. We look at those elements. We look at our populations. We talk to our populations, and then we tailor our strategies based on this slide number 3, designing appropriate interventions. That way we know our interventions will be more effective and not just be something we're putting together that's not a good use of time or money. I've seen that time and time again in public health. And that's not something that we want to be a part of, as those of us with the Master of Public Health. The next slide, intervention, treatment. An intervention is something that you're creating because you have goals and objectives you want to achieve. And again, in your case, Ms. Schrader is telling you what your goals and objectives are, which makes it easier for you. But when you finish this program, oftentimes, like I've been thrown into, you will get a general health problem like suicide prevention or mental health. And you will need to create goals and objectives with your boss, or maybe you're the boss, and your community partners, or the person who is the boss above you. You'll need to create those, and you want to develop something that will be effective, theory-based. Again, you'll be taking theory later on. An intervention also has a very specific time set. It's not something that just could go on for 5 years. It might go on for 5 years, but you've decided that from the onset. I've worked on a lot of grants. You'll probably work on grants. And when you write a grant, it tells you how many years that's for. So it's very time bound. Multiplicity. Really effective interventions often have more than one type of activity, and we'll get into that in just a moment. Also, dosage. Think of dosage just like taking medicine. With most health promotion programs, not all, but most, the higher we can do our dosage in a way that makes sense for our population, the more likely we're going to get behavior change. How many of you can take a moment and think about a health workshop that you went to that was just maybe 1 hour, maybe 2 hours? How impactful was that for you? I can think of many workshops that I've been to. Some of them were impactful at 1 hour, and some of them required for me to go for several days or maybe even several weeks. For example, Weight Watchers is a very popular intervention. Oftentimes, people participate for periods of time over months in order for it to be effective and in order for them to incorporate the behavior into their own lifestyle. So that's another example for you. Going to the next slide, the Centers for Disease Control classifies strategies. Now, I know this PowerPoint may appear this a little bit older, but all the years I've been working in health promotion, and as we look at the different texts, the strategies that we're presenting to you today are consistently the types of interventions or health promotion strategies that are used universally. We'll move on to the next slide, health communication strategies. I was a public information officer in the state of Idaho. We worked very hard at that time to communicate mental health messages to our parents, to lawmakers, to teachers, anyone who could listen, that they would realize how important mental health was to our children. And I had the privilege during that time of working with parents and lawmakers and even the governor's wife and spreading the message that we need to destigmatize mental health. So that was our objective. And so as you can see here with health communication strategies, health communication is a part of everything that you'll do. No matter what the strategy is, you will need to communicate with your priority population, the people who you're trying to reach, college students in our case. You need to communicate with them your general health message. What are you doing? Why are you doing it? What is the health issue? There's a lot of different communication channels, as you can see on this PowerPoint slide. In your case, it'll be more interpersonal. You'll probably be communicating with people on a population level. But then again, because everything is virtual, it may be more intrapersonal, which means individually based. So people will look at the computer screen and they will internalize the message on their own, which may be a little different from a general health fair. On the next slide, I have some examples for you about health communication activities. They're all around us, right? The Susan G. Komen Foundation, I put a link there for you. They're masters at health communication. Why do I say that? Everyone knows what the pink ribbon means. And for women, we know it means prevention. Do a breast self-check, get regular mammograms. That's masterful health communication. And maybe when you go to work somewhere, you won't have Susan G. Komen money. I often didn't. But it's still good to look at that website and think about common themes and strategies. I want to drop something in for you at this point. As a health communication officer, one of the terms that we use is called single overriding communications objective. Single overriding communications objective. That's something you could actually Google if you would like. Journalists and other communication people use it all the time. That means as you are creating your campaign, you want to have one single overriding message. So like for Susan G. Komen, one of their SACOs would be get checked, do a self-breast exam. You hear that so many times until when you think about them, that's what you think about. That's what a SACO is. No matter what you're doing, you want one simple, short, some type of message that's going to help people to remember what it is that you want them to do. What do they need to remember about their health? So as you can see, there's a lot of different kinds of strategies, social media. So you'll get to think through that, thinking about general health promotion as you become a master of public health and thinking about your actual project for this semester. There may be some things where with Miss Schrader, you're promoting some things to college students via social media to get them to join the virtual health fair, which could be anything from Instagram to TikTok to whatever it is that people are using at this time. But again, based on your tailored segmented population. The next slide is health education strategies. As you can see, there's curriculum, scope, sequence. So again, we don't reinvent the wheel. Sometimes, as you will see on your final project sheet for this class, there are curricula already available, especially if they're free, you want to go and you want to use those. Those make sure that you're covering a certain scope or breadth that you want for your program. And they also ensure that you're delivering your program in the right sequence, right? Because if I'm doing something on weight loss, I want to talk about what obesity is first, and I want to learn about my participants before I jump right into the strategies of how to lose weight. So that's what we mean by sequence. Another example of that is all of your college classes have a very specific sequence to them so that you're learning things in order and you're building on different types of knowledge. Health education strategies number 2, your programs are always going to include units of study. For example, with weight loss, your units of study could be how to lose weight, how to manage your weight loss, how to handle your friends, how to pick the right foods. It could be a lot of different units that are all associated with maintaining a healthy weight. So those are units of study, as you can see in the slide. And this may be useful to you if you end up doing school health, or even as a health educator, if you end up doing something where you need to create or help with some type of curriculum. Health education strategies 3. If you use health education, you really want to consider this from the legendary reading of Kinsey, 2005 Events of Instruction. The model I want to give you for health education is tell, show, do. If you're providing health education, tell people what you're doing, give them basic information. So tell. Show means provide an example. People learn if they see an example of what you're talking about, which is why I have examples of links in this lecture for you to view at your leisure. The third thing is do. So in this class, you're going to do a project because that allows you to integrate your learning and really demonstrate that you've learned how to do some type of health promotion project. So tell, show, do is really the heart of health education. And that's what you see here under Kinsey on health education strategies number 3. He talks about gaining attention. That's where you would tell something, provide a stimulus, make sure your message is culturally competent. What do people relate to? If you're in Tennessee, depending on your audience, maybe it's a type of music they relate to, maybe even a type of food. You want to include that in your education. And all of this comes from your needs assessment, by the way, what you've learned from your needs assessment. So present stimulus, provide guidance. That's the show part. So we did the tell, then the show is providing guidance. Elicit performance. Performance is do. So tell, show, do. Tell your learners what you want them to know. Show them. That means there's an example. Use trustworthy models to demonstrate. And then do. Elicit performance and provide feedback. So do means you give the people you're teaching an opportunity to do what you're teaching them. Then you can use different kinds of quizzes or tests or even reviews or some type of way to make sure people can retain what you've taught them. And this goes into social support. When you get to do a class, you can also enhance the sense of community, especially if you're doing it with some type of community club or religious organization. It's a great way to enhance the retention of the material that you're providing instruction on. As an example, I was involved with evaluating an exercise program for women in another state. And this program had different modules. It was religious, so it included prayer, and it went over at least a year's period of time, and it included evaluation. At the end of this physical activity program that was culturally tailored for these women, because they were women who were religious, but they were also African American women. And as they tailored this to religion and also considerations of different types of foods, the 12 to 24 month evaluation demonstrated that the women did have significant weight loss. And at 24 months, they were still engaged in physical activity, which was the heart of the study, the physical activity. I'm going to move on to not the lesson format slide. We're going to skip that. I'm going to move on to health policy enforcement strategies. We are living in a perfect example of that, right? The city of Nashville has ordinances for wearing masks to reduce the spread of COVID. We were all involved in a lockdown in the month of March in the whole country. So these are examples, and these are things to even think about with college students. What kind of things are appropriate for ordinances on campus? Great example. MTSU is a smoke-free campus. You're not supposed to smoke within the buildings of MTSU. Um, and even outside, you're discouraged from smoking. So is that an infringement on rights? In public health, we're looking out for the greater good. So that's a good discussion. And remembering that health policy and enforcement strategies indeed can be effective. That includes seatbelt laws, all the things that we do to enhance the public's health in general for the greater good. With health enforcement strategies, of course, going to the next slide, we need all different kinds of support. Sometimes we don't do it right away. With COVID, remember, there are different phases of businesses opening. That speaks to the bullet point on the slide of sometimes things are implemented in phases. Sometimes things are rolled out in phases. Communication is essential. Buy-in is essential. So we could go on and on about health policy and enforcement strategies. So as you're developing your project for Ms. Schrader, be very mindful of any policies that are on campus already that might enhance or enforce what you're doing in terms of your topic. Or as you speak with her, if you would like for your part of the project to really be about bringing more awareness on campus of specific policies or enforcement strategies. So that is another strategy. The next strategy that we will cover will be environmental change strategies. These are about changing things around you. I've lived in communities where I wanted to go take a walk, but I really couldn't because there were no sidewalks and it was very unsafe for me to do that. So anything we can change in the environment, walking paths, fresh food availability, again, that could be something on campus. Is there really fresh food available on campus? I think there's been great strides made in that, but that would be an environmental change to enhance that. The example that I have for you is the Miracle Field in Murfreesboro, and you can look up that link. It's an incredible park for children who are differently abled, which is the appropriate term. And you can look at that when you get a chance. But of course, that's changing the environment so that children can get physical activity regardless of their type of ability. Moving on next to health-related community service strategies. A good example of this, HRAs, HHAs, these are health risk assessments. As a student at MTSU, you can get that done for free anytime at the health clinic through health promotion. These are things that we do as community services, even health fairs. These things promote health. Even now doing the COVID testing in Rutherford County free at the health department, this is a community service strategy. The next strategy that we want to address is community mobilization. I've been privileged to evaluate community-based organizations that impact reducing HIV in the South. And these organizations are amazing. One organization in Mississippi found out that there was a line. If you were trying to get assistance from the Department of Health and you were HIV positive, they forced you to sign that you would not have children. When this organization was made aware of that, they were livid. They galvanized the community, HIV advocates, everyone around them to have the health department there remove that line from the application to get public assistance. And I could tell you tons of other stories about advocacy. Community mobilization is a strategy. It's very important for you to know as a health promotion specialist, as a person of public health. This strategy leans directly into health policy. Often communities mobilize, like that community in Mississippi did, to pass laws or to remove ordinances or executive orders or things that are mandated by organizations that are not healthy for the community, that are a problem for communities. You can see the link down there. There's an organization called Nashville Cares that's also linked to an advocacy organization. Just check out some of their advocacy and how they are involved in the law. And I also worked with an organization in Florida that signed petitions to have better Medicaid laws that involve people with HIV/AIDS. So tons of examples, but definitely to keep in mind. The next slide has a list of advocacy activities that we've kind of talked about. Lobbying, the group that I know in Florida that advocates for HIV, they have a email list, and when they need action or something changed in the law, such as some of the Medicaid laws or making sure that people with HIV can get medications, they galvanize more than 20,000 people to reach out to their legislators to tell them that they need change. And they have affected change in some of those things in many cases. The next slide, other strategies, behavior modification. This is more one-on-one. If you end up being a health coach, you may ask someone to keep a diary of their health behaviors or health activities and then create a plan with them. I would encourage you, if you're thinking about going the one-on-one route, to consider learning about motivational interviewing. That also is something that you can look up online, but it's all about motivating people through their own goals and their own mission for life, as opposed to what our goals and missions may be as health promoters. The next strategy, going to the next slide, other strategies, organizational cultural activities. So, is there a cultural festival going on with your population that you're thinking of? Is there something that works with the culture of college students that you can link your health change to? Spring break is a college cultural event. Miss Schrader and many other health educators, right before spring break, will put on different events to talk about staying healthy during spring break, sexual health, um, staying safe while you're away, even some nutritional health, all those kind of things. So what about the culture is important for you to link with? Maybe there's a heritage festival for a certain group that you're working with in your state or in your city. When I worked with American Indian populations in Idaho, I was consistently invited to sweat lodges. Now, I never got a chance to go, but sweat lodges are a key part of American Indian health. They believe it's crucial to physical and mental and spiritual well-being. So they literally go into these places that for us would be similar to a jacuzzi type environment, and they are sweating, but it is a spiritual ritual and cleansing for them. And so those things have been linked to mental health care, and including that when we talk about mental health for American Indians. So what makes sense as a cultural organizational activity? Also, the culture of an organization, as we have on this PowerPoint slide. When you go, if you're going to go and do an employee wellness check for a hospital, maybe you become an employee wellness specialist in the hospital, which, by the way, is a great job. I have a former advisee that has that job. She loves it. You need to find out what the culture of the hospital is. People there may be more health conscious than other people. So you may get to put on different types of activities there because of the culture, or in other words, the norms. When we talk about culture, we're talking about the norms and the beliefs and behaviors of an organization or a group of people. So that is what you want to consider. What are their traditions? Is there an annual picnic? You want to use all of that. Next, we have other strategies, incentives and disincentives. You want to ask the population you're working with what motivates them and what doesn't motivate them, and then utilize that within your programs. This can be a desirable reward, as you can see on this slide, that people tell you about that they want to have. When you go out into the field, though, please ensure that your organization allows you to use certain incentives and that all of these are ethical and that they work along with your culture. You don't want to create an unhealthy competition between communities if it's not appropriate. This will be just a little over 30 minutes, but we're almost on the last few slides, so thank you. Other strategies, disincentives and incentives and disincentives. Again, as I mentioned earlier, people can't be denied insurance, and you don't want to ever deny somebody an incentive. You want to also consider people's ability to participate in programs. If you have people who are differently able, different ages in your health promotion program, you don't want to make the incentive only for people who can run 10 miles because that's unfair if it's a physical activity program. So again, talk to your priority population. Find out what motivates them. Find out what they're willing and able to do. Partner that with your evidence-based programs and create something that works for your audience. The last one that I'll go over, social support activities. That's actually one of my areas of research. An easy way for you to think about that is to, when you're doing a program, find out what kind of support people already have available. In the ladies program, what I mentioned earlier, the physical activity program for African American women, that was done over 12 months in churches with some people who already knew each other. And over that time, it gave them a chance to meet new people and get to know each other. And when we read through the data, time and time again, the women told us, I got to meet women I didn't know about. Some of the younger women started encouraging me to exercise and do things that I hadn't done before. That is the heart of social support. And there's a lot of different ways that that can happen through networks and different activities. So even for this virtual health fair, consider promoting your program through social networks, which could be Greek Life, Sorority Life. MTSU has tons of organizations on campus. Consider that as you're working with Ms. Schrader to promote the health fair or your program. Last but not least, health promotion interventions do have guidelines. You want to think about risk factors that people have, again, what they're able to do, not able to do, making sure everything is well organized, well planned out, and there are codes of ethics. Now, the example we have here is the American College of Sports Medicine. But if you go to the American Public Health Association, and I would like for you to do that, there's also a code of ethics within public health. And I'm sure Dr. Rye will speak with you about some of those things. So to close out, we have gone over numerous health promotion strategies as identified by the Centers for Disease Control. And that includes health communication, health education, health policy and enforcement, environmental strategies. That also includes community mobilization. We talked about behavior modification just a little while. Organizational cultural activities. Those are all different types of strategies. These are the major strategies that are used internationally in health promotion. And these are things you can consider in your final project as well. Well, I'm right at 32 minutes. So thank you for indulging me for an extra 2 minutes. Thank you for your time. If you have any questions, you're more than welcome to reach out to me. Dr. Rye has my contact information and it's also on the website. So thank you and enjoy your project. Have a great semester. Bye-bye.